This is the scrotum, okay? This is the scrotum that holds the testicles. This is the testicle on this side, this is his testicle on this side, okay? If we look at the testicle, we can see that there's this C-shaped piece of tissue here that kind of comes around on the testicle like this, right here. That's called the epididymis. This is the tail of the epididymis. You'll be able to see this a little better when I use the bull testicle. This is the tail of the epididymis. This is the head of the epididymis. This is the testes right here. This is the spermatic cord here coming up with the artery and the vein. That has to go through the abdominal wall, through this hole right here called the inguinal canal. And sometimes that can rip in men, and that's when they have an inguinal hernia where the intestines are coming out down here in the pelvic cavity. Once we get through that wall, here's our spermatic cord on this side. This is the bladder, by the way, that I'm hanging on to here. That's the urinary bladder. And then here's the spermatic cord on this side coming through over here. Okay, so it comes up, goes through the abdominal wall, and comes over here behind the bladder. So this is the urinary bladder. Okay, this is the tube leading out of the bladder called the urethra. That goes out of the body. The spermatic cords come up behind the bladder, right here. This tube right here is the tube coming down from the kidney. That's called the ureter. There's one coming down from each kidney. The spermatic tubes cross over the ureters, and come in behind the bladder on the back side of the urethra. Just below the bladder, you can feel here there's a little ball. That's actually the prostate gland. So spermatic cords come in past the prostate gland and unite with the urethra, because the urethra is the common pathway for urine and sperm. And then the urethra extends down through the penis. This is the penis here. This is the shaft of the body of the penis. This is the glans penis, or the head of the penis here at the end. Okay? That's just real basic boy-cat anatomy here. All right? Then if we look at the